making good things happen and stopping bad things from happening before, because people said bad things about you before if you make good things happen and stop bad things from happening. Or whether you want somebody who spent a lifetime making positive changes for other people. And here's my pitch for Hillary. First of all, I have to tell you, knowing what I know about the job of the presidency and the immense challenges of this moment, if I had known her since 1971, but we had never been married, and she asked me to come here to be for her tonight, I would do it in a heartbeat, because she's the best candidate for president. No disrespect to Senator Obama, who is an amazingly inspirational and charismatic candidate. No disrespect to Senator McCain, whom I like and admire. And no disrespect to all the other Democrats who have run, who were an amazing group, who had themselves done an awful lot of good for the American people. We had a great field of candidates. Says that if you want to get America together again, we got to get them together the way we always get together in America, when we have something to do together. When we decide our differences are not as important as our common humanity and our common objectives. And what does she want to do? She wants first to restore the middle class dream and let poor people have a chance to work their way into it. For our young people, our leadership in science and technology, and our leadership in the fight against climate change. To restore our standing in the world for peace and cooperation and prosperity and security. Those things sound good. How does she propose to achieve it? First of all, to restore the middle class dream, we have to do several things. Number one, we must finally quit making excuses for why America is the only rich country in the world that cannot provide affordable health insurance that every Raise your hand if you know somebody without health care. You know somebody? I rest my case. Every time I do this, somebody says me. And we all know someone. Here's why you know someone. 1/6 of our people never have health insurance. 1/3 of our people are without health insurance at some time during every year. And a lot of us think we have health insurance till we file a claim and we're told what we really need is not covered. And yet, our system costs $700 billion more. $700 billion more, that's the size of the trade deficit, than we would pay if we had any other country's healthcare system. If you took Japan or Germany or anybody else, you just dropped their system in America, it would be $700 billion. So, here's what Hillary's alternative is. And let me back up and say, because we have had a doubling of health insurance premiums, because paperwork burdens and administrative costs now consume almost 1/3 of American health dollars, because medical errors galore are made because we don't have electronic medical records, because doctors are having to just churn patients through and bill people separately instead of spending the time they want to practice medicine, we now have, for the first time in my lifetime, not just labor, but big and small businesses for universal health care. Not just nurses and hospital administrators and health policy advocates, but the doctors as a group demanding universal coverage. People know we have got to do this if we're going to fix the economy and make it help every decent society. Here's Hillary's plan for affordable quality health care. Number one, to cover everybody. If you like what you've got, you can keep it. If you don't like it, or you can't afford it, or you're not insured, you can buy into the same plan that insures members of Congress and their families and all other federal employees and their families. Quite good. It's got about 250 choices, so whatever your family situation is, you can pick and choose what you need. If you need mental health coverage, you can get it. If you have children, you need dental health coverage, you can get it. You can get what you need. If you don't have kids in the home, either because they're grown and gone but you're not old enough for Medicare, or you're young and single, or not single but without kids, you also have a third option. You can buy into a plan just like Medicare, which will be somewhat less expensive with lower administrative overhead. But in any case, you can't be denied coverage because somebody in your family's been sick, and you cannot be charged an arm and a leg for the premium because somebody in your family's been sick. The reason that will be possible is we are all going to be in huge pools. Keep in mind, every year about 80% of America's medical costs are claimed by 20% of its people. 2004, I was one of them when I had my heart surgery. And I took from you. But for most of my life, I've been healthy as a horse before and since, and I paid in more than I took out. That's what insurance is about. That's the way it's supposed to work. And once you have millions and millions of people in, that's why we can sell all families health care on affordable terms, even if someone in your family's been sick. And it's the morally right thing to do. It's the economically smart thing to do. You must be covered, however. But here's the deal, nobody will be charged more than they can afford. If you cannot afford health care, that is, if it's above a certain modest percentage of your income, you will be eligible for a tax credit. Money back from the government to pay for it. Even if you don't pay income tax. Even if you're just paying Social Security tax, you get a refundable tax credit. So no American will pay more than a certain fixed percentage of their income. So we can all afford it. But we must all be covered. Otherwise, according to yet another study which came out just a few days ago, published widely in the New York Times, over 20 million of us won't have insurance even if it's affordable, and that means we will still get health care when we get really sick or we're in a car wreck, we show up to the emergency room, we cost twice as much as we otherwise would, and somebody else has to pay our bill. And we get right back in the soup of spiraling costs again. To make this work, we have to have universal coverage. That's what every other wealthy country in the world does. Hillary says it's time to stop making excuses in America and get the show on the road. I'm in Maine, so I imagine you want to know how we're going to pay for this. Because if something sounds too good to be true, it probably is, right? So here's how it would be paid for. Number one, the tax cuts on the top 1% of Americans would be allowed to expire. I just love saying this because I'm one of them now. And you know, for most of my life, I didn't have a nickel to my name. I had the lowest net worth of any president in the 20th century when I went in. When I left, as you might remember, I had even less. But as soon as I made money, I became the most important person in the world, my president and his party. Here we are, we had soldiers in Iraq and Afghanistan, and a lot of them were kids that I had known since they were infants. They didn't want me to help support them. They kept throwing these tax cuts at me. This is not about soaking the rich. Americans don't resent people who are financially successful, but we do think we should all pay our fair share. This is about paying